So what makes us different than any doctor that you've been to? Well, we treat you both metabolically and neurologically. No stone is going to be left unturned to determine the exact cause of your health condition. So you're looking at this video right now because either you or someone you know suffers with a chronic health condition. I'm Dr. Jonathan Klar, and I am a board-certified chiropractic neurologist. I see a lot of chronic cases in my office, and they really all have two things in common. Number one, there's problems with them metabolically. Number two, there's problem with them neurologically as well. So this is really how we treat these chronic cases. We use specific metabolic and neurological protocols, and we look in places that really other people have not. So specific metabolic testing and treatments, we use sensitivity testing to determine if you have a sensitivity to gluten, which is found in wheat, rye, oats, and barley. We look to see if you have a sensitivity to milk, eggs, yeast, and soy. If you have a sensitivity to any of these foods, this is making your condition worse, folks. It can be causing more inflammation in your body and in your brain, and we don't know unless we run the test. These are very important tests to run. Some of the symptoms that are associated with these sensitivities: chronic pain and fatigue, fibromyalgia type stuff. This is stuff I see in my office every day. Frequent indigestion, bloated after eating, abnormal bowel movements, either frequent or not enough. Okay, we see both of those as well. These are signs that things aren't right in there. Obviously stomach pain, but guess what? Joint pain is a huge one. Peripheral neuropathy is a huge one. These things are all associated with food sensitivities. And again, we don't know if you're suffering from these unless we do the tests. So we also do a complete blood panel. We use specific blood tests such as a thyroid panel, a complete metabolic panel, a lipid panel, a complete blood chemistry with autodifferential. We can assess different glands and organ tissues in your body: thyroid, adrenals, liver, kidneys, red, white blood cells, your gut function we can assess. This can all affect chronic health conditions. By addressing any problems with your thyroid or your different glands or functions, we can help you to heal faster. This also allows us to test certain things like what we call blood glucose levels. Every cell in your body is dependent on a proper supply of blood sugar. So whether it's too much or too little, things are not going to work properly. So for example, one of the main things I get in my office is patients say, well, I've had the blood tests are normal. A couple things with that. Number one, we're looking at functional ranges or health ranges, and most people are looking at lab ranges. Lab ranges are pathology ranges. You can be outside of the functional range, but yet still not outside the lab range and considered normal. Yet you can be feeling symptoms when you're outside the functional range and still within that lab range. These are most of the patients that come to our office. They're not really a pathology, and if you wait till the pathology develops, we've actually waited too long. So we need to address these kind of things before they occur, or while they're occurring rather. For example, if we look at your fasting glucose, a normal functional glucose should be between 85 and 99, okay, fasting sugar. If you're beneath 85, you're going to have more what we call reactive hypoglycemic type tendencies: fatigue, dizziness, irritability when meals are missed. Whereas if you're over that 99 to 100, you're starting to develop more insulin resistance type symptoms. Maybe falling asleep after meals, that's a very common one. Folks, if that blood sugar is off, guess what? A lot of other things in your body are going to go wrong, leading to your chronic health condition. So we can assess what's called your adrenal stress index, your adrenal gland, or through an ASI. That adrenal gland is the gland that sits above the kidneys. That's basically your stress gland, but it's involved with blood sugar regulation as well. So when you sleep at night, you're obviously not eating, but blood sugar has to be sustained, otherwise you can wake up in obviously with low blood sugar diabetic coma. We don't want to do that. So your adrenal gland tells your body to secrete sugar into the bloodstream to keep you asleep and keep you going through the night. So what happens is the people that usually have adrenal stress problems, they're the people that have trouble getting to sleep. They sure as heck can't stay asleep. And getting up in the morning is very difficult for them as well. These are the things we see with adrenal stress. These are our chronic fatigue, chronic pain type patients because they can't heal. They're not getting any rest, folks. Another thing we'll see with this is orthostatic hypotension. People that have a change in blood pressure going from lying down to standing up. The adrenal gland's not kicking in enough to change that blood pressure for them. This is another sign of an adrenal stress insufficiency. But people that usually have stuff like this are consuming lots of caffeine and soda and different drinks, and it's basically just whipping a dead horse when it comes to adrenal fatigue. You just keep beating that gland up. So if the patient suffers from insomnia or diabetes, this test is really a must to measure cortisol levels. So we need to assess your gastrointestinal system as well, your GI system. This tells if there's a parasite, maybe a yeast overgrowth, abnormal bacteria ratio, whatever can be contributing to your health and driving this problem. We got to be specific, we got to be thorough. 99% of your serotonin, which is your happy neurotransmitter that makes you feel basically alert and awake and happy and enjoy life. We see a lot of depressed people out there, okay? If you have a problem with your gut system, guess what? That's going to affect your serotonin, how it's released and produced. Another positive side effect of a lot of nutritional things we do in here with our patients is, number one, patients lose weight and they feel like they haven't felt in years. So that's a pretty positive side effect. We can assess hormone panels as well, obviously for females, to see what's going on with your estrogen progesterone levels, to see what, why you're having depression, fatigue, mental fogginess, mood swings, hot flashes, sweating attacks, so on and so forth. This is very important stuff, but a lot of this is dependent on things like blood sugar. As opposed to seeing you're low in estrogen and giving you estrogen, we're going to assess what's going on with the other things that help you make more hormones, the precursors to that. That's very important. Now, obviously in the neurological aspect, we do things a bit differently as well. So basically, I'm a natural neurologist. We specialize in treating those that have been to different doctors, had all the tests, the MRIs, the CTs, and procedures, and the results are negative because there's no visual pathology on there, yet you know something just is not right. We use specific brain-based therapies such as vibration therapy, which can fire the back part of the brain called the cerebellum, which is responsible for all the control of your core muscles that surround your spine. We can use auditory stimulation. Different visual exercises are really popular in our office. Olfactory stimulation. Anything we can do to basically increase the frequency of firing of the areas of the brain that are weak. Okay? We utilize laser therapy, or cold, low-level laser light therapy is what we use in here. It helps the tissue heal faster. We use this on chronic pain patients. We use this on peripheral neuropathy patients. Helps you heal faster. We utilize non-surgical spinal decompression, which is a computerized table we use to help open up compressed herniated discs or spinal stenosis. We are the only provider in the area with the ATM2 device, or Active Therapeutic Movements device. Again, helps with chronic core instability, chronic low back complaints, chronic neck complaints. Helps reestablish that brain control. We use this on brain injuries as well. We're the first provider to have the interactive metronome, which is a device we use, a computer-based program that uses visual, auditory, and motor stimulation to help increase the firing of the brain. Great for our ADHD kids, great for post-stroke, great for regaining motor control over a weakened area. Go to interactivemetronome.com to learn more. So once we've run the necessary tests to determine your condition, then we can successfully treat you via proper neurological and all-natural nutritional protocols. But we need the proper information to address your case correctly and keep you from bouncing to doctor to see what's wrong and why things aren't adding up. So you need to ask yourself the following questions. Number one is, how has your condition affected your relationships, your finances, your family, or other activities up till now? What is this costing you in time, costing you in money, costing you in happiness, and just overall enjoyment of life? Where do you picture yourself in the next 1 to 5 years if you don't do something about this? And what is this worth to you if we can improve your condition? Folks, I see people that spend thousands of dollars on their vehicles, a hunk of junk that they drive around, okay, because that's what it is. It just gets us from point A to point B to maintain that. And they'll take a loan out for that, but they won't take care of this thing that they live in every day. That's very important, folks. So if you'd like more information regarding your chronic condition, you can call our office for a free copy of our extended version on seminar dealing with this kind of topic. You can check out all our life-changing testimonials by going to our homepage and clicking on the testimonial button on the left-hand side, or you can go to lifechangingcare.com and you can see video testimonials from patients all across the country receiving this type of treatment. Thanks so much for your time.